Hey, Haley. You back so soon?
I was afraid you'd miss me.
Always. You still throwing up?
No, that's all better.
Right after we saw you, what, 3 days ago, she started getting a fever and chills.
Tried ibuprofen, but it didn't come down.
You did the right thing. When did you finish your last round of chemo?
Yesterday.
Usually the chemo fevers don't last this long.
Or get this high. 103.
You think something's wrong?
Hard to say. The cancer meds do knock down her immune system, so I wouldn't be surprised if she got some sort of infection.
But probably nothing to worry about.
Probably not, but I would like to start her on some antibiotics and get labs and cultures just to be safe. Looks like we'll be spending a little more time together.
What's going on?
You remember my cancer patient, Haley Klein? Sweet young girl?
Yeah.
This just showed up in her cultures.
Oh, God. Colistin-resistant Enterobacter.
She can barely fight off infection as it is. Now she has an antibiotic-resistant superbug? This is really bad news.
Natalie, it's worse than you think.
What do you mean?
This is Eric Tillman. Just came in. He has CRE2.
The same bug? Are you serious?
Labs just confirmed it.
So we could be looking at an outbreak that might not have a cure. I have some news. The lab tested Haley's CRE culture against every antibiotic, and it turns out it's sensitive to just one, a drug called ceftazidime avibactam.
So there's a cure. That's fantastic.
Yes, but the thing is, the bug is sensitive at a very low rate, which means it works best for patients that we catch early.
So Haley?
We won't know anything until we try the medication.
I waited too long, didn't I?
No.
Oh, I should have brought her in sooner.
Mrs. Klein.
I am usually so on top of this, but I can't tell it's an emergency anymore. She's always so sick.
You cannot blame yourself. Please, this is not your fault. I promise you we are going to do everything we can to help her.
Okay. Thank you.
She can't get a breath. I need to
Ma'am, please
intubate.
move.
5%.
What's going on?
She could be in septic shock.
I don't know. Pressure's fine, pulse is strong.
What's going on?
Please come with me.
Okay.
I can't get the tube in. It's like something's blocking it.
Did she eat anything?
No. Damn it.
So that's down to 50.
Doris.
Give me the ultrasound.
Got it.
I need a crank kit.
What?
I need to make a hole in her trachea so she can breathe.
Oh my God.
Wait, you're right. Her airway is blocked.
It's an abscess. The infection spread to her pharynx.
I'll pay GNT.
No time. Give me a minor tray and a knife.
I got it.
It's okay, I can do it.
No, I got this.
Stats down to 50.
Hold her arm, please.
And I have to crike her.
Hang on.
Oh my God.
Dr. Manning, thank you so much.
Lungs clear.
Baby.
I'm sorry, but the CT shows that there is significant swelling in Haley's brain. The cause is acute liver failure.
Acute?
There are things we can do for her. We have her on medication that will help reduce the swelling. This is Dr. Abrams. He's a neurosurgeon. I've called him to consult.
I'm gonna put in a drain to relieve the pressure on your daughter's brain.
With your permission, of course.
Are you talking about brain surgery?
I do it bedside. It's not a difficult procedure.
My baby. My poor baby.
It's okay, honey.
We are going to do everything that we can for her. I'm... too soon to tell. We have her on dialysis. That'll take over the function of her liver.
Is our daughter dying?
No. No, she's not. With dialysis, she will stabilize, and her labs should improve. Unfortunately, the damage to her liver could be permanent. She may need a transplant.
Oh my God, a liver transplant?
Another operation.
She's been through so much.
I know, but Haley's a fighter. I've seen these things turn around. We're not giving up. She could pull out of this.
Thank you.
I did something today that I shouldn't have. I have a patient, an 11-year-old girl, non-Hodgkin's lymphoma. I'm treating her for some time now. Her name's Haley. She came back in today, in acute liver failure with acute cerebral edema.
Sorry to hear that.
Yeah. Dr. Abrams put in a ventricular drain. We've got her on liver dialysis, waiting for a transplant.
Sounds about right.
This, on top of her lymphoma, I mean, she is in very bad shape, Dr. Charles. Like, and I told her parents that she could pull out of it, that I've seen it happen before.
Haven't you?
I gave them hope, and I don't think there is any.
You really know that, though?
I didn't give them an honest assessment, though. I let my feelings get in the way because I so much want Haley to pull through. That I didn't act professionally. I didn't prepare them
Nat,
for...
you can't torture yourself. Really hard drawing these lines, you know? When do we know we become too involved? At the very least, you can't fault yourself for caring. You know? I don't think Haley's parents would want anything less, right?
Yeah. Yeah. Thank you.
Dr. Abrams?
Tell me if you concur.
Pupils are large, sluggish.
What does that mean?
No, wait. Wait.
What are you telling us?
Unfortunately, the swelling in your daughter's brain is so severe that it's affecting the brainstem.
BP's spiking. 200 over 100. Heart rate's falling.
She's crashing.
Call a code.
She's in BFib. 1 milligram of epi charged to 200. Now. Hold compressions. Clear.
Still in BFib.
Charge to 200. Another milligram of epi. Hold compressions. Clear.
VFib's fine, VFib.
Asystole.
Susan, she's gone.
Gone?
Are you sure?
Yes. May we stop?
Stop.
I need your permission.
Yes. Please, for God's sake, let her be.
No. Come on. Come on, baby. Come on. Baby, come on.
Dr. Joy?
Jessica Pope. She was found by fire with a bag over her head. Resuscitated at the scene in a coma ever since.
Attempted suicide.
Or murder. PD's investigating. The thing is, her bone marrow biopsy just came back. No stem cells, nothing. Looks like it was blasted by chemo.
Cancer patient. Might explain suicide. Let me know if anything changes.
You got it.
How is she?
The same. It turns out she was on chemo. What do you guys know about her?
Not a lot at this time.
That's all that was salvaged from the scene.
It's her personal belongings, a couple books, receipts. We processed them, didn't find anything useful.
Hey, Daniel, why don't you take a look at this?
Never know what you might find. A lot of receipts, organized. Get ready for tax season.
Guys, forensics just came in. They only found her prints at the scene. There's no signs of foul play. All the evidence is pointing to suicide.
No change in her labs yet. Let's run another test in 4 hours.
Dr. Troy,
Yeah.
I heard about the bone marrow depletion. It's the focus of my research. There are so many discrete causes and variations. I thought we could run a few extra tests to rule out any possible.
Whatever you think, Reese. Titrate her norepi to keep her map at 60. We'll need to up the rate on her vent.
I'm not convinced.
About what?
Jessica Pope had a confirmation for a round-trip ticket from Paris 6 months from now. Okay, presumably when she's in remission. A conservative, responsible person with cancer, they doesn't do that unless they have high hopes, right? So she's sick, but she thinks she's getting better. Why'd she kill herself? Something's hinky.
Hinky. Did you just say hinky?
No, but humor me. You know, women almost always leave suicide notes. Where's the note?
Well, maybe it was destroyed in the fire.
Or maybe it wasn't a suicide.
Have you been binging on Mannix again?
You don't like it? Stop sending me box sets for Christmas.
All right, okay. Next year will be Sanford inside.
Dr. Halstead, do you think that your policeman brother might do you a little favor?
Turned over some rocks on the Jessica Pope case like you asked me to.
And?
I had the documents lab restore some papers from her place. And I found this.
Thank you. Dr. Charles.
Suicide note?
But she didn't do it because she was sick.
My fault because I trusted him. I'm a fool. I can't live with this betrayal.
Maybe a lover?
Is this the whole thing?
That's all they could restore.
What's going on? Jessica Pope. Suicide after all.
Really? Because I just got some very weird test results. They confirm she's dying from an overdose of chemo.
What's weird about that?
The results also show that she never had cancer.
Just a very weird case, you know? Turns out Jessica Pope did try and commit suicide. But that's not what's killing her. It's an overdose of chemo for a cancer she does not have.
She was misdiagnosed?
And overtreated.
Someone needs to have their license taken away.
Yeah. At the very least.
You wanted to see me?
Yes, come in. The patient that was hit by a car.
Yeah, Danny Frank.
I'd like to expedite the autopsy.
Everything I did was by the book. She was non-responsive, and until I could rule out a bleed...
Not questioning your performance for a second. Dr. Choi's patient, Jessica Pope, she's dying from an overdose of chemo.
And we know Danny had a chemo port.
And she seized before she was hit by the car. Could indicate an overdose.
Dr. Charles wants to make sure these two cases aren't related.
Okay. Yeah, I'll get pathology on it.
We need to intubate.
Copy. Scope.
She's biting down. Give me 20 of etomidate, 100 of rocuronium.
Copy.
She's dropping.
20 of etomidate.
Come on.
100 of rocuronium. O2 down to 87.
Got it.
O2 down to 84. 83.
Give me some cricoid pressure.
Can you see the cords?
Uh-huh. I'm in.
81. 84, 88, 91, 97, 100.
She's stable. Take over bagging and hook her up on a vent. Excuse me.
Dr. Halstead tells me that your chemo patient, despite your continuing efforts, continues to decline.
Carol Shepard, yes.
Dr. Choi has a patient in similar circumstances, though it turns out that she never had cancer at all.
You know, now that you mention it, Carol has oral cancer, but I've never been able to find a tumor. I thought maybe it had cleared.
I think it'd be a good idea to run some biomarkers. Just confirm she had cancer in the first place.
Do you think there might be a connection between Ethan's patient and mine?
Hope not. Gentlemen.
Dr. Charles. Danny OD'd on chemo. That explains why she seized in the street.
Yeah, it's not the troubling part. Yeah, she was loaded up on chemo. But this woman never had cancer. Two patients in one day overdose on chemo, and neither had cancer.
Which I must admit does seem suspicious.
Well, it could be a new oncologist in town making incorrect diagnoses.
Or even just mixing up a few charts.
Yeah, but even then, why the overdoses? And on the same day?
What do we know about these women?
Jessica's note said she felt betrayed.
And Danny's girlfriend said Danny was upset about something, but wouldn't talk about it.
Something was going on with both of these women.
Yeah, but we don't have any medical records, no information that might link them. I'm gonna get in touch with some local oncologists, see if there've been any problems with their chemo or if they've had other patients in the same condition. Thank you.
Sure.
Natalie,
Yeah.
Carol Shepard's biomarkers just came back. She never had cancer.
You're sure? So she is just like Ethan's patient.
And Dr. Rhodes' patient, Danny. That's 3 today.
Oh my God.
3 women, all cancer-free, overdosed on chemo. Somebody's doing this on purpose.
Do you think a doctor's doing this? Giving false diagnoses and overdosing?
I do.
It's a long way from do no harm. I've called the police. They're on their way.
Dr. Manning, I presume? I know, corny.
A little. But making jokes? Feeling better?
Compared to before, I mean, it still feels like I got hit by a truck. What happened?
Your body wasn't producing enough insulin to control your blood sugar. No, it spiked and it knocked you out.
The diabetes.
Yes. But the crisis period is over. Your blood sugar levels are improving. You okay?
It's just a little tender.
You mind if I take a look?
Oh.
Pain scale 1 to 10?
12.
Okay. How long has your stomach been hurting?
A few days. I mean, it's winter break. It's just more cheap beer and pizza than usual. I figured it was just indigestion. Is it the diabetes?
No. Gallstones. I would like to run some additional blood tests and get an MRCP, a more detailed scan of your stomach, okay?
Mm-hmm.
Is there anyone I can call for you?
No, my dad's on his way.
All right.
He had them. Gallstones. They're a fat person's problem, aren't they?
They are often tied to obesity, the diabetes as well. But you know, with lifestyle changes, these things are manageable.
You mean like diet and exercise?
You're only 21. It'll be easier than you think. I'll be back shortly. Hi.
Setting up grocery delivery. Farewell, supermarket temptations.
Well, that's a good first step.
Mm-hmm.
You know, there's some great apps for tracking calories, too.
That's way down the line. I mean, after I get a handle on GMOs, gluten, organic versus farm fresh, that's why I like fast food. It's simple.
You know what? Why don't I page the hospital's nutritionist, have her come in for a consult? You okay?
I've just been feeling a little bit short of breath, and
Just come on now?
a couple minutes ago. Is it a reaction to all the meds, or?
No, they're just sparking your immune system. It shouldn't affect your breathing. Sit up for me. Lungs are clear. Is the extra oxygen helping?
No, not really.
Will, I need a hand. Stat portable chest x-ray.
What's going on?
Blood sugar's normal. White cells, amylase, lipase, they're all down. Everything's good, except now he can't breathe.
What's happening?
Your blood pressure and oxygen levels keep dropping, so we're gonna take a chest x-ray to try to figure out why.
Mass in the lung.
I'm hearing a rub. It wasn't there before.
All right, let's get an echo.
I can't breathe.
O2 keeps dropping, switching to a full face mask.
Pericardial effusion.
What does that mean?
Yep, keep this on. There's fluid built up around your heart. It's constricting it from beating. Bolus another liter of fluid, get 125 milligrams Solu-Medrol IV and a leave-a-fed drip. Page Dr. Rhodes, we need to tap the fluid off his heart. 5 minutes ago, he was getting better, and now he's sicker than when he came in.
Okay. So the fluid's from acute pericarditis.
Stemming from the massive lungs.
Drain's a temporary fix, but his heart is really struggling. CT chest will show exactly what we're dealing with.
He presented with hyperglycemia and gallstone pancreatitis. There was absolutely no evidence of a heart problem.
Time with Dr. Downey, not Dr. Latham. The one constant. Cardiac events can strike without warning. Bulky, swollen lymph nodes and a clear primary mass in the right lower lobe of the lung.
Non-small cell lung cancer?
The biopsy results are pending, but I'm almost certain they'll confirm it. I'm going to talk to Dr. Latham about surgical options.
All right, I'll consult with oncology, get their opinion as well.
Yeah. Hey, sorry, Nat.
Thank you.
So how long would I have to do chemo for?
That's up to the oncologist. Generally, it's given in cycles between 1 and 4 weeks long, followed by a period of rest.
How many cycles?
On average, 4 to 6.
What about side effects? The internet lists thousands.
It all depends on how Ted's body reacts. But yes, the side effects can add up. And because of the gallstone pancreatitis, they may even be exacerbated.
Well, all of this sounds awful. What am I looking at with surgery?
Removal of the mass via thoracotomy. I'll open your chest and peel away the growth from whatever it's attached to.
But my pancreatitis, a few hours ago, it was too dicey for gallbladder surgery. How is it okay with all of this?
Your cardiac function is compromised. Preventing heart failure has to be our chief concern.
Dad, I don't know what I'm gonna do. I feel like if I make the wrong decision right now, I'm gonna die.
Do you need an answer right now?
Ted, look, I understand this is all overwhelming, but you're very sick. The sooner we start fighting back.
Emergency radiation. Yeah, a single dose intended only to stabilize the mass in your lung. It'll give the pancreatitis a few more days to heal, and it'll give you and your dad more time to decide on a treatment.
And if I still choose surgery after, it'll be safer, right?
Theoretically, yes.
When can I do it? The radiation.
Today, I will set it up with the radiation oncologist.
Dr. Halstead, a moment.
Yeah.
Dr. Manning's patient, Ted Baylor. I understand surgery was proposed, but that radiation will be tried first?
Well, as a short-term measure.
Yeah, it's the size of the mass that's killing him. Radiation only stalls its growth. It doesn't shrink it.
Well, Dr. Manning's opinion and mine is that radiation is a much safer option right now.
Well, you're the attending. Keep me posted.
From now on, clean nutrition, lots of cardio, diet and exercise. My dad, too.
That's the enthusiasm I was hoping to hear.
We gave him a second chance. I'm not wasting a day of it.
Good for you.
Okay, let's do this.
Natalie. Hey. I am so sorry that I didn't say something sooner. I was afraid I'd lose you. Say something, please.
I was terrified to move on from Jeff. Even more afraid to get involved with you, my husband's best friend. And yet I thought there is no one Jeff would approve of me being in a relationship with more than you. And you let me think that.
He's coding. I need help.
What happened?
He just dropped.
Take over compressions?
Got it. I got it.
No pulse, VFib. Charge 200. Charging. Hold compressions. Clear. Resume compressions. Another milligram epi. Charge to 300. Charging. Hold compressions. Clear.
Asystole.
You gonna call it?
Time of death, 1732. He was dead before the first alarm even went off. COD, tumor lysis syndrome.
No way.
You know, the radiation was supposed to stabilize the mass. Instead, it caused it to burst. I might as well have just given Ted a lethal injection because that is essentially what happened.
Natalie, this is not on you. There are no predictors for tumor lysis syndrome. It is monumentally rare, even more so in young people. And the few times that it does occur, overwhelmingly, it's a reaction to chemo, not radiation.
It still feels like I missed something.
Well, you didn't. No doctor sees gallstone pancreatitis with diabetes and thinks volatile cancerous chest mass.
And yet here it is.
Ted's death is not your fault.
Need some help out here. Got a patient down.
Get a gurney out there. She's seizing. She looks like she's full term. Must be eclamptic. Lucy, get me 10 grams of magnesium. On it.
Name's Desiree Parker. She had just signed in. Husband went to park the car.
Desiree, I'm Dr. Manning. Can you tell me where you are? You're in a hospital. You just had a seizure. Let's get her on the backboard.
Yes, doctor. Okay. Let me get you into the room.
All right, let's lift her on my count. Ready? 1, 2, 3. All right.
She's seizing again. Lucy?
Injecting magnesium.
Magnesium isn't working. Get her 2 milligrams of Ativan IM. Let's check her vitals and get her some oxygen.
Well, there's the fetus, but she's not even close to full term. Maybe 20, 21 weeks. But she's so big. Whoa, that's all free fluid. Maybe she's cirrhotic?
No, she has cancer. My wife, she has ovarian cancer. Stage 4. What is it? What's wrong?
Honey. No, it's okay. Desi, your CT scan shows that your cancer has metastasized to your brain.
Oh, God.
There's a large tumor on your right temporal lobe. That's what caused your seizure. I knew the risk I was taking when I decided against treatment.
Yeah, we got the diagnosis when we were 3 months along with a pregnancy.
With Elijah. That's his name. I was already stage 4. It was highly unlikely that treatment would be successful.
Unlikely, not impossible.
I didn't want any interventions that could harm the baby.
What are our options?
Well, given the size and location of the tumor, a craniotomy is recommended to resect it.
Brain surgery?
That could hurt Elijah, right?
Well, they would take every precaution, but yes, general anesthesia does pose a small risk for the fetus.
Then no, I won't do it.
Desi, we agreed not to take treatment off the table completely, especially as circumstances evolve.
Could you give us some time to discuss it?
Of course.
I was just headed to you. Have you and Desi made a decision about surgery?
Not exactly. Can we? My wife and I, we agreed that if the cancer progressed quickly, that she would reconsider treatment. The tumor in her brain, it could be impairing her judgment, right?
Yes, it's a possibility,
So
but
maybe she can't make this decision.
Caleb, I understand that you're overwhelmed, but Desi did appear to have all of her faculties.
Hey, I know my wife. Okay, she's not thinking clearly, I'm telling you.
Okay, I will have the head of psychiatry evaluate Desi.
Thank you.
Hey, Desi. How are you feeling?
Okay, just a bit drowsy.
That's from the Ativan. It should wear off soon. In the meantime, I wanted to introduce you to Dr. Charles. He's our head of psychiatry.
Psychiatrist? Why?
Desiree, I just want to ask you a couple quick questions, if that's okay.
You can meet Desi.
Sorry?
Call me.
Bagger?
Desi! What's going on?
Let's come to the room.
The right pupil is dilated and sluggish. I need to tube her and send her to CT stat. I suspect edema.
It's a swelling of the brain.
20 of etomidate, 100 of sucks.
Do the surgery.
Mr. Parker.
I'm her surrogate decision maker. I said do it. Now.
Daniel, do you believe Mrs. Parker lacked the capacity to refuse brain surgery?
I never got a chance to evaluate her, but a tumor in that area certainly has the potential to affect reasoning, understanding.
Desi has been consistent in her refusal of treatment since her initial diagnosis.
She also agreed to consider additional treatment as the disease progressed.
Well, is there any written record explicitly stating her wishes?
Just the advance directive.
Which clearly establishes her husband as her surrogate decision maker.
This isn't right. Her husband is taking advantage of the situation.
But doesn't the fact that she granted him power of attorney in the first place demonstrate a bond of trust?
A bond that he is breaking by completely disregarding her wishes. If we operate and anything happens to the fetus,
I'm sorry, Dr. Manning, but the advance directive stands.
Dr. Charles? You know where Dr. Manning is?
I think she's with another patient, but they should be coming to prep Desi for surgery very soon.
No, it's not that. Without the operation, Desi's never gonna wake up, is she?
It's unlikely.
So she'll lose the baby, right?
Well, not necessarily. The plan would be to continue to treat the swelling in her brain with steroids, which should allow her to remain on the ventilator long enough to deliver via C-section once the fetus becomes viable in a few weeks.
You mean she'd become what, a human incubator?
You know, that's not the term that I would use, but,
I know what she would want me to do. I just,
You're terrified.
Desi and I were just kids when we met. Freshman year of college. Yeah, we've really grown up together. You know, we've seen each other through everything. And she knows me better than anyone.
Yeah. And you know her better than anyone. Which is why she trusted you to become her voice when she was no longer able to speak for herself. And Caleb, look, letting go of somebody you love when every instinct is telling you to hold on, to fight, I mean, it's the hardest thing in the world. But Desi knew that you were up to the task. Now you just have to come to believe that you are too.
We'll be moving Desi up to pre-op, and Dr. Abrams will be waiting
No.
for us up there. I'm sorry?
No surgery.
Can you give us a moment? Caleb, are you sure?
Yeah. Cancer took everything away from Desi. But this is the one thing she was determined not to let it touch. She's been so brave. For me, for Elijah, the least I can do is try to have an ounce of her courage.